Welcome to day 96 of the DeStress series. There you go, birdies. Some water. Hope this day is finding you well at Quantum's Liberty. Today on the phone we have Teddy. Teddy is from Colorado, and Teddy's mom and dad are MDs in Colorado, and they are thinking that Colorado needs to have a little bit more teaching about the coronavirus. So this DeStress series is it's a countdown to health until mid-February, when the virus was projected to slow down and not be quite so prevalent and surging across the United States. So what we're going to do is we're going to start tapping on the karate chop point here. This is a DeStress series, so it's to reduce the stress levels by reducing cortisol levels and adrenaline levels in our bodies. And when we are tapping for 10 minutes, and we do a week of tapping and meditation for that week, then the biochemistry shifts significantly, and we have a 37% reduction in cortisol, and also an increase in the immunoglobulin levels. So we're going to tap as we talk about the news. One of the things about tapping is it's a breakthrough technology for reducing the impact of the release of stress hormones in response to images or auditory, hearing bad news, being triggered in some way that would stimulate the response system to go into overdrive. So what we're doing by tapping on the points is we're listening to the news, but at the same time we're tapping on these points so that the firing of the neurons to the amygdala is slowed down, even though we're listening to the news. And in this way, we'll be able to take care of having, I just noticed a little note there, sorry, from my sister. So we're going to be able to take care of taking in the news, but not having us be so stressed out. And in that way, with the reduction in the stress, oxygen, instead of going to the arms and legs to run from danger, it will stay in the prefrontal cortex, where you can think about the next right thing to do during the COVID-19 crisis, such as wearing a mask and social distancing. So we have, let's see, where should we start? Let's start with the news. And then we'll talk about Dr. Jonathan Samet from Colorado, who has some news on how we can protect ourselves during the pandemic surge that is occurring primarily in the United States and in Europe right at this moment in time today. So 24 states, keep on tapping, and nice deep breaths. All right, Teddy. So Teddy's mom and dad are MDs in Colorado, and so they're seeing the COVID-19, and we're just going to talk about some of the news, so tap away. Here we go. 24 states reported record numbers of cases since the pandemic began, including deaths. And the big states right now that are being affected are, of course, Colorado, Indiana, West Virginia. Virginia was added today. Let's see, Nebraska, Wyoming, and New Jersey, and South Dakota after that big rally. So the deaths and cases are reported record numbers. And so the surges are similar to the surges that were in New York and Florida earlier in the year. And since November 3, the United States has had greater than 1,000 deaths every single day. Whew, that's a lot of people missing. And I know how that feels, unfortunately. But also the 6 White House aides are also stricken with coronavirus, Yesterday, we had 1,220 deaths, and we had another 132,700 cases. In Simi Valley, California, we're having quite a surge down in LA, and so the public health order was that the mask must be worn in restaurants and things like that. So the county asked that the police officers would be able to help restaurant owners to talk to people who were not willing to wear a mask inside a restaurant. I know, don't get it. But the thing is, we can't be laughing at them or angry at them. We have to try to understand why. Why aren't they getting this, right? And maybe it's just that they don't have the information. Maybe that they need to see the inside of a hospital or go to a morgue where it's really busy and then see what is actually happening. Maybe that would help. But anyway, at the county and the state level, the government is saying, no, it's not really fair to have the police be able to go in and say, you have to wear a mask, right? They're just saying, no, we're not going to be able to do that. That's not fair to the police officers. So the nice thing that happened out of that was that the police officers agreed to at least just go to the situation and help the restaurant owners talk to the mask, the people who were not willing to deal with the mask orders. Keep on tapping. So we have a global surge in the United States and in Europe with 50 million infected and 7,500 deaths a day. We do have a new team coming in. Dr. Fauci and Dr. Birx, BIRX, have been really helpful in trying to send out national mandates or ideas on what they think ought to be done. Fauci said last week he thought a national mandate for masks would be helpful. But we are going to be having coming in the Dr. Vivek Murthy, Murthy. He's our former Surgeon General under Barack Obama. And so President Biden and Vice President Kamala Harris are already talking with him today so that we can get a good vaccine, have the health supply and distribution for vaccines done, and that for virus response right now that we need to have mask wearing and maintain social distancing. So there will be some regularity in data based on science that is important for everyone to know. So in Colorado, where Teddy's parents live, Dr. Jonathan Samet, S-A-M-E-T, he is the primary physician and a pulmonary physician, an epidemiologist, the dean of Colorado School of Public Health. And so they had a meeting, and he was saying that the problem in Colorado is that there's going to be no hospital beds soon. So he's telling the Colorado citizens to please don't relax over the holidays, because we really are heading in the wrong direction right now. So we do need to head in the right direction, and that can be done by wearing a mask and social distancing. Wash your hands for 20 seconds with soap, counting 1, 1,000, 2, 1,000. And you can also tap to immune boost and to reduce your stress levels. And that will help us all get through till we get through to mid-February, and then we'll reassess. But today's day 96 of the DeStress series. So first we're going to focus on we're going to focus on the ideal image of beautiful, radiant health. So close your eyes and imagine yourself in beautiful, radiant health, and see yourself walking and talking and thinking, and you have radiant health with or without COVID-19 in your environment. Just imagine yourself in radiant health. And then I want you to picture if there's any resistance to having that radiant health. If you feel any image someplace in your body or some kind of energy flow that doesn't seem to just match that vibrant energy, just focus in on that and write down the number on 0 to 10. How high is that resistance? 10 being the highest resistance you can have to having radiant health, and 0 being no resistance at all, I'm already there. So let's begin tapping on the karate chop point. And Teddy and others, you can repeat after me because we're going to be doing an immune boosting session here. So what we know in quantum medicine is that when we have, in science, when we have a monk, say, hooked up to hooked up to a PET scan, that PET scan will register how quickly the glucose travels across the membrane, and when that happens because a thought is occurring. So a PET scan will register the glucose traveling when a thought is occurring. Now, so the monk can empty his mind completely. Keep on tapping. The monk can empty his mind completely of all thoughts. And so the PET scan makes no noise at all. But so scientists hooked up the PET scan to a little click noise that would click when glucose traveled across the membrane, across the neurosynapse, and then that would be when the monk had a thought. So every time the monk had a thought, the PET scan would go click. Now the other thing that the scientists did was they took a photon or an electron and they put it in a vacuumed, empty room, a room, devoid of other electrons, and they put it in that room, in that space, and they said, now to the monk, there's an electron somewhere in this room, and we just want you to think where it could be at any moment in time. You decide where it's going to be. Like, you are emptying your mind completely, and then just have the thought, the electron's there. And then empty your mind completely and just have the thought, the electron's there. And so what happened was they hooked up the electron to a Geiger counter. And a Geiger counter registers mass. It's a radioactive detector. And so in the quantum universe, everything, electrons and photons, it exists as both a field of possibilities, but it also exists as a particle. And when it exists as a particle, it has mass. And when it has mass, it emits a sound wave or a radioactive wave, and the Geiger counter picks it up and it goes click. So when the electron is in a field of possibilities, and it's not a particle, where it could be anywhere in space at all, then that is considered a wave, a possibility of wave. And then what happened was when they hooked up the PET scan to the monk, and they hooked up the Geiger counter to the electron, they found something interesting. Every time that the monk said, the electron is there, or the electron is there, the electron would assume a particle, it would become a particle. And so it would emit a radioactive frequency and it would click. And so what would happen too was at the same time, looking for the picture, at the same time, the monk would have a PET scan go click because the thought traveled and thought the electron's there. And then when the monk had no thought, the electron it was just in a field of possibilities. And so quantum theorist Dr. Amit Goswami, one of my heroes, he noticed that, so every time, and this is replicable so many times, every time the monk thought the electron's there, the PET scan and the Geiger counter would go click simultaneously. And so what this meant was that the minute that the thought occurred, then matter emerged from the field of possibility, and everything else, all other possibilities faded away. So this meant, they called this, Dr. Amit Goswami and other theoretical physicists call this downward causation. So what we can do is we can tap on an image of our radiant being, right? And we can maintain and hold that image with intention. And we're going to do that. We're going to tap away any obstructions we have to having that image. And then we're going to tap on having that image of radiant health with or without COVID-19 in the environment. So here we go. Repeat after me. And thanks for bringing this up, Teddy, because this is really important that people have the right information from science. Okay, repeat after me. Even though I have this resistance to beautiful radiant health, I deeply and completely love and accept myself exactly as I am. Even though I have this lovely resistance that's just residing inside my body or my mind, I forgive myself. I trust myself to have my own back. And I accept me exactly as I am right now. Even though I have this resistance to lovely radiant health, I deeply and completely accept and honor every facet of my being. And I love myself completely, exactly as I am. This weakness inside of me, this resistance to having radiant health, this wanting to bond to being unhealthy, this desire to not be healthy, this block inside of me that says, no, I can't have radiant health. Any resistance at all to health. I'm resisting the idea of radiant health with coronavirus in my environment. I'm resisting feeling bliss. My body and mind are resisting this. I'm looking straight at it. I really want to run from it. I want to run from this image because I don't feel I deserve it. Wait a minute, I do deserve. Maybe I don't deserve radiant health. Maybe I don't deserve health during coronavirus. Maybe I don't deserve to feel exactly healthy. So many people are being unhealthy during coronavirus. Could I deserve this? Yes, I do. Yes, I can stay vigilant. I can be vigilant during the holidays. I listen to science and I know what is happening. I do the tapping so that I can think of the next best thing to do. Many states are heading in the wrong direction. Perhaps if they listened to science, they would head in the right direction. This is what Dr. Jonathan Samet says of Colorado Public Health. This is research and it's science. From a pulmonary physician and epidemiologist. And the Dean of Colorado School of Public Health. He probably knows what he's talking about. I can wear a mask during the pandemic, as he suggests. And I can use some social distancing and hand washing. And I can have this radiant health. It's very simple. Don't give it. Don't get it. No, it's airborne and dangerous. I can do these things. I see myself walking in radiant health. I see myself talking with radiant health. I am walking and talking with radiant health in mind, body, and spirit. Okay, Teddy, thanks for bringing that up.